Hi there, everyone. Jason Kenney here, and I am at the Calgary Premier's office here to take your questions on issues that matter to you for the next hour or so here on Facebook Live. You can just, of course, as usual, put the questions in the comment section below, and our team will choose a good cross-section of questions from different points of view. We can't get to all of the thousands of questions that normally pop up here, but we'll do our best as soon as you've got some on any issue that you like. It doesn't have to be about COVID, but other issues, of course, as well. I'll be making a big announcement tomorrow about Alberta's largest ever job training program as part of the Alberta Recovery Plan to get unemployed and underemployed Albertans back to work. So just stay tuned for that. I'm going to go to the first question now. Kathy Basil says, what is the plan to reopen? So Kathy, as you know, we are still in this third spike. Alberta continues to have the highest total active cases per capita of any province or state in North America. And we're also at a historic high in our intensive care units with patients overall, with about 187 COVID patients, another 55 or 60 non-COVID patients. So very significant stress in our hospitals as a result. So we expect to continue to see growth in hospitals and particularly intensive care for the next week or two. But the good news, Kathy, is that Albertans have responded in a big way to our call to stop the spike. And we are seeing the numbers start to drop, go in the right direction, and the vaccines are going up also in the right direction. We just crossed past 50% of eligible Albertans having received their first dose. And of course, we're leading Canada on second dose administration. And I believe we have up to 800,000 additional vaccine appointments booked over the course of the next 4 weeks, during which time we are scheduled to receive another roughly 1.3 million additional doses. So put all of that together, and it is to say that we've got to stay with the current public health measures for a little while longer, but we will be considering next steps early next week, right after the Victoria Day long weekend. And as I said in a news conference yesterday, we are developing a reopening plan that is focused on two key metrics. One is the level of hospitalizations, because they are very high, and the other is the level of the percentage of population that has been vaccinated or has some level of protection, because we also have 10 to 15% with some natural immunity from prior natural infection. So I would just say, Kathy, I would say stay tuned for about a week from now, when we should have, I think we'll be in a position to present to the public our plan to reopen, again, pegged to hospitalizations and vaccinations. And here's the good news. With the velocity of the vaccine program right now, where we're getting about 50,000 people a day vaccinated, we really will be in a much, much better situation in June and then headed into July. It's very much my hope that we'll be at about 70% population protection as we move towards the end of July, and that will be a game-changing number. So just stay tuned for, I think, a significant update on all of the above about a week from now. All right, Josh Rands says, why are so many pastors getting arrested? Josh, we have about 10,000 clergy in Alberta of different faith traditions, and I'm aware of 3 of the 10,000 who have been arrested for contempt of court, and that's why they've been arrested, to answer your question. So we're talking about 99.999% of the pastors and clergy in Alberta who have not run into problems with law enforcement or the courts, but I'm aware of 3 out of the 10,000 who engaged over months in a flagrant, open and public and complete violation, not just of one, but of all of the relevant public health measures that have been in place to protect lives and to keep our healthcare system from being overwhelmed. Josh, I would remind you that first of all, these people, these arrests happened because the Court of Queen's Bench in Alberta put in place an injunction against further law breaking from these individuals. And no one is above the law. Not me as the premier, not a judge, not a police officer, and not a pastor. We live in a society characterized by the rule of law. Our freedoms are protected by that tradition, that system of the rule of law. And so it must be applied with equity. I believe that in Alberta, the enforcement agencies have been extraordinarily patient in all three of those instances, giving, together with Alberta Health Services, repeated information, educational efforts to seek compliance, warnings upon warnings upon warnings, and only then did the court grant an injunction, and only then, after the injunction was violated, were these three individuals arrested for contempt of court. They've all been released on terms. They all have their day in court. They all have access to our fair and independent judiciary. They all have access to defend and protect their rights as guaranteed under the Charter of Rights and Freedoms. But let me just take this another step further. These are individuals. Imagine if these three individuals who have basically said that they will not recognize any government limits on how they operate worship. But there are government limits. A church or a place of worship has a fire code limit, for example. They also have to follow occupational health and safety rules. They have to follow labor legislation for their workers, and safety code, etc. So those are normal aspects of operating procedure for every institution, every business, nonprofit, faith institution. And if people flagrantly violate those things, there are consequences. That's what it means to live in a society governed by the rule of law. So let's take, for example, imagine if a pastor, for example, were to flagrantly disregard the fire code. Let's say that they would have a fire code for 100 people, but they try to pack 200 people into their church every week. Well, the fire department would come along and probably say, this is inappropriate. They might give them a warning, and eventually they might ticket them. But eventually the police might have to take action, and the courts might too as well. Well, just think about that for a second. We have a tiny number of deaths as a result of fires in Alberta in a given year. Last year, I'm not aware of any fire deaths related to a place of worship. But in the last year, we've lost 2,100 Albertans to COVID-19, and many of them who contracted the disease at places of worship. And in fact, I'm not aware of any fires in places of worship in Alberta. Perhaps there were last year. If there were, they were a very small number. But I am aware of dozens of virulent outbreaks of COVID-19 in places of worship. Now, that's not to blame places of worship. The vast majority have been extraordinarily careful. But here's my point. If a pastor is willing to respect fire code on the infinitesimally small chance of a fire breaking out, then why is that pastor unwilling to respect health code when it comes to a deadly, virulent global pandemic, which has taken the lives of many people who had contracted COVID at places of worship? So I would say to those and other faith leaders that, certainly to the Christian pastors you're talking about, the 3 out of the 10,000 faith leaders in this province who have flagrantly violated the law and flagrantly jeopardized the health of their neighbors, that a core tenet of their Christian faith is the sanctity of human life. It is protecting the vulnerable. And I think it's unfortunate that some have recklessly disregarded that biblical mandate in flagrantly operating in a way that violates common sense public health measures. But I would like, on a positive note, to thank the other 10,000 faith leaders and the thousands upon thousands of churches, temples, synagogues, mosques, and other places of worship who have carefully sought to protect their congregants and the broader community by seeking to limit the spread. All right, Amanda Francis says, can you do something about the outrageous distribution fees on gas and electricity? Well, actually, Amanda, I was just talking to our Associate Minister for Natural Gas and Electricity, Dale Nally, about exactly that issue a couple of hours ago. and he has an expert panel reviewing how we can address this problem of the distribution costs for electricity in particular. Alberta benefits from having low-cost energy production, but we do have high cost of transmission, and that is in part because previous governments, going back 10 and 20 years, arguably allowed an overbuilding of the distribution of the networks for electricity transmission in Alberta, on the expectation that our economy would continue to grow at sort of 5 and 6% a year, when in fact our economy today is smaller than it was 5 years ago. So the economy didn't expand to use the enormous redundant surplus electricity distribution system that's in place. But that system cost billions of dollars to build, and now the costs get passed on to consumers. That's the way the electricity market works. So we've got a group of experts helping us to figure out, is there some way that we can reduce those costs, perhaps by amortizing those costs more over time? We're working with the power producers, with the distributors on exactly that. All right, Amit Chaudhry says, when do most Albertans expect to have the second dose of COVID vaccine? Thanks, Amit. Well, about 8% of Albertans currently do, Amit, which is good news, because I think the national average in Canada is about 2 or 3%. So we did go further on the second doses for the elderly and vulnerable earlier in the vaccine program than other jurisdictions. And that may be one of the reasons why we have continue to have one of the lowest per capita death rates in the country, that the vulnerable have been so well protected. But the answer to your question is, I anticipate we'll start to pivot back towards more of the second doses as we get into June. The scientific advice is very clear, both from the National Advisory Committee and the Alberta Advisory Committee on Immunization, drawing on studies and research from around the world. They have concluded, and also drawing on the real lived experience in places like the United Kingdom and Israel that are months ahead of us on vaccination. And the upshot of all of that data and expertise is that it is far more effective and more protective of the population to distribute more first doses and hold back the second doses for a period of time. Now, we believe this is safe. In fact, in terms of the AstraZeneca, the clinical data in the United Kingdom is that a longer duration between first and second dose actually is more effective. So I expect that we'll start to see more of a move back towards the second doses, certainly as demand starts to taper off for the first doses. And of course, we want to stay within the 16-week window for the Pfizer and the Moderna in terms of the second doses. So we'll be starting to move more towards those in June. John Tim says, Premier, thank you for answering these questions. Can you speak to some of the latest developments regarding Line 5? Yes, thanks, John. So I'm sure you folks know Line 5 is that Enbridge pipeline that for 6 decades has been carrying over 600,000 barrels of Canadian light crude, mainly from Alberta, across the Strait of Mackinac into into Michigan, and then Sarnia, Ontario. And then through Line 8, it carries... Line 9, it carries oil up to Montreal. So half of the fuel consumed in central Canada comes off this line, and most of the fuel consumed in the upper Midwest, like Michigan and Ohio, comes off this line. Governor of Michigan has been trying to decommission it on the grounds that it is somehow unsafe, operating under the lake bed on the Straits of Mackinac. But in fact, there's been not a single spill incident in 60 years. Enbridge wants to invest a huge, I think $600 million in burying that and building a new pipeline that's subterranean under the lake bed surface, so that they can bring down to virtually nil the chance of any marine spill in that area. But the governor is not willing to give them the time. Now, what's happened is that her order to decommission the project has no legal effect unless it is confirmed by a court order. So there are two simultaneous legal challenges going on. One is at a Michigan state court, another is at a federal court, and there's also an arbitration process going on between Enbridge and the governor of Michigan. And so we're waiting to see what happens in those three procedures. I won't speak to the arbitration, but I will tell you our legal advice is that the governor doesn't really have a leg to stand on. She does not have the authority to do this. And moreover, there is an international treaty about 40 years old between Canada and the U.S., which makes it, which bars either country from interrupting a pipeline which transships energy between the two countries. So we believe that we are standing on very solid legal grounds. The Government of Canada, in cooperation with the governments of Alberta, Saskatchewan, Quebec, and Ontario, has filed what's called an amicus curiae brief at both the state and federal courts. I've done everything I can to lobby the Michigan government. I went down there in the fall of 2019. Unfortunately, Governor Whitner refused to meet with me, and but the Governor of Ohio, Governor Mike DeWine, did. He's very concerned and on our side, as are the governors of Indiana and Illinois, who also receive energy off this pipeline, as are a majority in both the state assembly and Senate in Michigan, as are the vast majority of the unions that carry a lot of political weight in the state of Michigan. So we've done everything we can politically, we're doing everything we can legally, and ultimately I think what the governor is involved in is very bad political theater, but another bad example of the highly coordinated campaign to landlock Canadian energy. All right, Justin Clark says, will summer festivals and fairs run this summer? Yes, Justin. I mean, ultimately, that's up to the organizers, but Alberta Health has had a team working with the organizers of major summer events for months now to work out parameters for safe operation of their events. And now, I would just say, obviously, outdoor events are going to be a lot easier to accommodate than indoor events. And when we say this summer, I would really say events starting in, I will be making an announcement about a week from now, as I mentioned earlier, about the path forward for reopening. And I do anticipate that some smaller events can be accommodated in June while we're still battling to get our hospitalization numbers down and the vaccines up so that we can get to broader immunity in our population. But once that's done, hopefully, knock on wood, towards the end of June, beginning of July, then I think we can go to potentially much larger gatherings. I'm glad to see that the Calgary Stampede has announced that they will be putting on the greatest outdoor show on earth this coming July, between July 9th and the 18th, I believe. And I very much hope it's going to be a successful Stampede. But how many people can go to these events and what kind of activities they can participate in will really be dependent on two things, and those are, over the next few weeks, how careful are we in limiting spread, and how many folks get the jab so we can get those vaccine numbers up. If we get the spread comes down and the vaccine numbers go up, I think we can have an amazing Alberta summer, particularly starting in July. Adam Court says, what's up with the UAV proposal? I know it's canceled, but what was the reasoning for such a proposal? More with the long weekend part of using the drones for watching campers. Yeah, Adam, I gather that the public service, I'm not sure whether it was which department, Environment and Parks or Service Alberta, put out I think a tender or request for proposals for drones to help the government of Alberta with monitoring forest fires. And as well, I know that the RFP mentioned camping during long weekends. As soon as the Minister of Environment and Parks learned about this today, he canceled the RFP, and Minister Nixon has said there was no one had briefed him or his office about that intention to have UAVs used to monitor campers, that would be an unacceptable violation of personal privacy. I totally agree. I think maybe the reason this came out of the public, the bureaucracy, is because in the long weekends, like May long weekend, we have hundreds of thousands of people gathering in both, of course, official campgrounds, serviced campgrounds, but also hundreds of thousands in the backcountry, in Crown lands, and so forth. And sometimes that activity results in forest fires. It sometimes results, unfortunately, in criminal violence, in deaths that require search and rescue, etc. People get lost in the backcountry, hiking, and so on. So it is a really big challenge for the Park Service to monitor all of that and to respond to all of the emergencies that happened during those incredibly busy long weekends in the summer. And I guess they were looking at UAVs that maybe help them deal with the issues like that. But the minister has said absolutely inappropriate to be monitoring campers. That's a violation of privacy. I totally agree. But I do think that we should be looking at a more narrow focus of using UAV technology to help search and rescue. Obviously, would be an obvious one, and fire monitoring as well. All right, Jay's Maracle says, "Hi Premier, what are the results of Alberta's War Room investigation into the foreign-funded anti-Alberta activism?" Thank you, Jays. So actually, that's a separate project. It's not in the Canadian Energy Centre that's leading that, but rather an independent commission headed by Steve Allen, a respected senior chartered accountant, and he's gone through I think about 18 months of work on that. There was a big effort by the Green Left lobby to shut down the inquiry because I guess they don't like the sunshine of transparency on where they're getting their money from or what they're doing to try to hammer jobs in the economy in Alberta. So they put in a lawsuit trying to suspend, to get a court to basically shut down the inquiry. And it was just last week, I believe, that the Queen's Bench Court in Alberta rejected completely that frivolous effort by these Green Left lobby groups, special interest groups, to shut down the investigation. So the investigation is proceeding. Commissioner Allen had to spend a lot of time and a fair bit of resources defending his inquiry from those efforts, and so he's asked for a bit more time as he pivots back to the completion of the actual report, and we've granted him that time. All right, Rob Wright says, "How much, Jason, how much did Big Pharma pay you?" Simple question, and was it more than Ford got? Rob, the answer is nothing. If you're implying that I'm somehow been paid off by pharmaceutical companies to support the vaccination program, frankly, Rob, that's just nuts. You say that without a tiny shred of evidence. Ridiculous. Rob, every single jurisdiction on the face of the earth, in every region of the world, every culture, every religion, every political persuasion, is using vaccines to protect their people from this deadly pandemic. It is our way out of the pandemic. The science on this is massive and clear. If you don't believe me, and clearly you won't, then just look at the real life experience in places like Israel and the United Kingdom that were the number one and number two countries in the world in terms of their vaccine program. So Israel has vaccinated, I think, second dose, they're approaching 50% of the population. First dose, they're well over 80%. Of course, they've been able to lift all public health restrictions. Basically, COVID does not exist, at least not as a threat to lives or the healthcare system. I mean, it will continue to circulate, and the odd person will get sick, and the odd person will require hospitalization once you get to so-called herd immunity in the population. But effectively, it no longer constitutes a threat. That is the case in Israel. It's the case in the United Kingdom. So if you're suggesting that I have been paid off by, quotes, Big Pharma to support the vaccinations, then you're making the same suggestion about every leader of every government on the face of the earth. And that is just a cockamamie conspiracy theory. Get a hold of yourself, man. Instead of attacking the pharmaceutical companies, how about we show a bit of gratitude to the scientists, yes, and the pharmaceutical companies, who worked a miracle of modern science to produce safe and effective vaccines in record time through massive trials, vaccines that are now saving millions of lives. Look at what's happening in India right now, a country of 1.3 billion people, where they've been suffering thousands and thousands of, some estimate over 10,000 deaths a day from COVID-19, where they've been incinerating bodies in the parking lots of hospitals. Why? because they didn't get enough vaccines on time. Even though they're a big vaccine manufacturer as a country, in a population of 1.3 billion, it's hard to produce enough, get enough supply to get population protection. But if they had that protection, if they had the same level of vaccine protection as Israel and the UK, millions of lives in India would be saved right now. So the cynicism behind your question is toxic. I think we should be showing gratitude to the scientists who developed these vaccines and to everybody else who's getting them out as quickly as possible. And I want to say thank you to the 50% of eligible Albertans who have already signed up to who've already gotten the vaccination, and another 800,000 who've signed up to do so. We need to keep up that momentum so that we can get back to normal. The vaccines are our ticket out of this. All right, Tushar Rajyuguru says, hello, Premier. When are we expected to be fully vaccinated? I mean, second doses of vaccines. Well, I've addressed a bit of that earlier, but right now, based on the current pace of vaccinations, the current appointments, and expected incoming supply, I hope, knocking on wood here, that we will be closing in at 70% of the population having received at least a first dose by the end of June. And then a similar percentage, about 70%, having gotten a second dose at some point in September. But I think it could be actually faster because we're now finally getting large quantity of supply. Alberta is scheduled to receive 1.3 million doses over the next 4 weeks. And we can inoculate, we believe, well, really, if we push the system and we have enough demand, we can inoculate 80,000 people a day. So it's really the thing we're most concerned about is that we just keep that demand coming as we've opened up the eligibility to everybody age 12 and over. I was going to say to our team here that unfortunately the screen has gone on the blink. I've lost the screen down here, but so I'll just keep talking about vaccines until we get her going again. There we go. All right. Nicole Borley Hertz says, why do you always use the UK and Israel as examples for studies and not follow what the US has done? I do follow what the US has done. I just often refer, Nicole, to the UK and Israel because they have had the most successful and most advanced vaccine programs in the world. So they're a pretty good laboratory, for a real world laboratory for the efficacy and safety of the vaccines. And the US is another good one. They weren't as early as those two countries. But I do talk a lot about the American example. You know, for example, Nicole, I am often asked, why can't Alberta be like Texas? Well, I sure wish we were in many ways, but a number of differences. They opened up completely. They dropped almost all of their public health restrictions in the first week of March. At that point, they are estimated to have had between about 33 and 40% of their population walking around with immunity through antibodies through prior infection, whereas at that point, Alberta, we were at 9 or 10% of the equivalent number. Okay, so they already had 3 to 4 times the protective effect of natural immunity. Secondly, at that point, they were already at about 15% of the population vaccinated. We were at 3% or 4 or 5% or something. Thirdly, their numbers were coming down partly because of the population protection they had. So their COVID numbers were coming down dramatically, and ours have been going up in the third spike. So they had less pressure on the healthcare system when we had more and more. Fourthly, they have way more healthcare capacity, about 3.6 times more staffed ICU beds in the Texas healthcare system than we do. And fifthly, seasonality and climate weather are a big factor in this pandemic, and you can see that in all of the studies around the world. The weather we're enjoying now would have been Texas weather in February, March. So they were able to get out more easily, and of course this thing mainly transmits indoors. So those are 5, but let me come back to the first point about natural immunity. How did they get to like 33 to 40% natural immunity by March of this year? By massive spread that had a huge toll in terms of lives. Texas has a population of 29 million. They've had 50,000 deaths. We have a population of 4.4 million, and we've had 2,000 deaths. So their death toll has been at least 3 times more Alberta's per capita. So those are some of the differences. You wanted me to comment on the states, and there you go. All right. We'll go to the next question here. I just see Nicole's. Sorry, we're having some technical difficulties, folks. Lawrence Headley says, where are you getting these questions? They aren't posted here. Well, Lawrence, I assume yours is. Every question that we get comes off the questions posted here. Our team, my only instruction to them is to get a representative cross-sample of questions from different perspectives, different points of view, and I just put yours up there. All right, Amanda Francis says, do you see our children having a normal school year this fall, meaning no masks, etc.? Yes. Yes, I do, Amanda. I do anticipate that the schools will be opening in almost all parts of the province next week. Just stay tuned tomorrow. The Minister LaGrange will be providing an update, but there are 1 or 2 regions where COVID is continuing to grow right now, including amongst younger people. So there may be 1 or 2 areas where we have to be a bit cautious, but otherwise schools I fully expect will be coming back in Tuesday following the Victoria Day long weekend through the balance of the academic year, and we'll be opening on schedule in August and September for a full in-classroom, in-school experience without masks in August and September of this year. And God knows the kids need that. We'll also be announcing some efforts to provide supplementary schooling to help kids who've fallen behind through this period of intermittent online learning. We know that many kids have been challenged by that, and especially younger children. So we'll be offering some additional educational resources and efforts, especially for basic math and literacy, reading skills for younger children particularly. Minister LaGrange will be making an announcement about that in the near future. All right, next question goes to Jerry Legrossi. Says, are all places of faith treated the same, following the same rules regarding COVID protocols? Yes, Jerry. There's no distinction made in the rules with respect to what religion or faith tradition or denomination they come from. They're all treated exactly the same. And let me say that we have seen outbreaks in churches, but also in mosques and in temples. And so COVID doesn't discriminate on the basis of religion. And so that's why we've all needed all places of worship to be COVID careful. All right, Zara Marie says, my children wanted to ask you their most pressing question. Mr. Premier, when can we do our sports again? Thank you, Zara, and thank you to your children. I can understand that they want to get back out there and get active, and that's a very good thing that they want to do that. Please just stay tuned. I think we'll have an announcement about that early next week. All right. Carly Schoollemmer says, do we still get the choice to be vaccinated, or are we going to be forced to do so anyways to be able to travel or go to sporting events? No, Carly, there is no mandatory vaccines and no vaccine passports in Alberta, and nor will there be, period, full stop. In fact, there is a bill before the legislature right now, Bill 66, which eliminates the provision in the Public Health Act that allows the government to force people to be vaccinated. That has been in the law since 1910, so we are currently repealing that, and we've made it absolutely clear that we will not be facilitating so-called vaccine passports. Now, I'll make one caveat to that. There may be foreign governments that will require you to show proof of vaccination in order to enter those countries. And in that case, if you get vaccinated, you're going to have that form that AHS gives you, and you can use that as your proof of vaccination. But that won't be our doing, it won't be our policy, it would be the policy of different governments. All right, Tanis Evans says, why are mosques allowed full capacities, yet churches are allowed only 15? That is absolutely untrue, Tanis. That is completely untrue. As I said in response to an earlier question, all places of worship are governed by the same rules. And let me explain, why do we have this kind of rule on congregational worship? Well, one of the reasons is we've seen a lot of outbreaks, dozens of outbreaks in congregate worship. Part of it is the nature of the activity. People say to me, well, why can only 15 people go into a church right now, but 100 could go into a grocery store, or a couple of hundred could go into a large box store? The answer is the nature of the activity. When you're in a place of worship, you are typically, there's a social dimension to it. Often people are singing or chanting or praying out loud. There can be sharing things like communion. There can be, other kinds of physical interaction through different kinds of liturgy and worship. People can come very close to each other, and afterwards there's also people know each other. They're often friends, and there can be a tendency to socialize. Those are the kinds of things that caused the outbreaks that we saw in many places of worship. Alberta has done more than any province in Canada to keep congregational worship open. I think we're the only province that never completely shut places of congregational worship. I very much regret that we've had to come back to this low number limit right now as we were going through this devastating third spike, where Alberta was ahead of all of North America in terms of per capita cases, and we were driving towards a cliff in terms of our healthcare capacity. In a typical year, we have about 170 staffed ICU beds in Alberta. Right now, we have about 230 people in ICUs. So we're about 40% ahead of our maximum typical ICU capacity. Now, we have worked very hard over the past year to maximize that capacity to 425 beds. But if we had allowed exponential growth of COVID to continue unabated without these recent public health measures, we would be well on our way to hitting the wall in terms of overflowing the intensive care units, which would mean triaging patients and denying them care. I can't believe that anybody of faith, that any Christian, Muslim, Hindu, Jew, anybody, a Buddhist, of any person of faith, would want that situation where our healthcare system is denying care to people who are deathly ill because we did allow the virus to run wild in this province. I think that every faith tradition would see care for the vulnerable, coming together to protect the common good, social solidarity to save lives as a moral and indeed a religious imperative, regardless of the faith tradition. All right, Zaza Soros says, are we going to reorganize the healthcare system after COVID? I wouldn't say reorganize it, Jaza. I would say we will definitely have to go back and learn lessons from all of this, but what we've done well and what we've done poorly, and how we can better protect ourselves should we ever be hit by something like this in the future. I think reorganizing for the sake of reorganizing just creates a lot of wasted resources. Alberta did that too much, I would say, in the past 30 years. We went from dozens of local hospital boards to one big provincial mega board to regional boards, back to a provincial mega board. I don't think reorganizing things in an administrative sense would help us. And I would say that actually our one unified healthcare administration, I believe in at least most respects, has turned out to be a success in the pandemic. I'll give you an example. With one unified purchasing authority, one procurement system, serving a population of 4.5 million, Alberta Health Services is one of the largest single purchasers of healthcare supplies and equipment in the world. And that's one of the reasons why we had privileged relationships with vendors, with suppliers, that allowed us to be so much better prepared with PPE and ventilators early in the pandemic, much better than other provinces. So that was a clear, and another example right now, when our ICUs are under real stress, we have greater flexibility to move staff anesthesiologists, ICU nurses, and other staff from one hospital to another, and to move patients between hospitals by having one provincial administration. But I do think an issue for us as a country to look at is the implication of having a rationed system. So I mentioned earlier tonight that down in Texas they have between 7,000 and 8,000 staffed ICU beds. I keep mentioning it's just one example, but that's broadly the case across the United States, where they have many more hospital beds, many more physicians per capita than we have. And that's because healthcare is big business in the United States. They spend 17% of GDP on healthcare. We spend in Canada about 11%. And they have, frankly, a competitive system. They have these different health management organizations, HMOs, and hospitals, profit and nonprofit. And altogether, they create a kind of redundant capacity. Whereas here, with a single-payer system that has to ration its resources, we don't have that kind of redundant capacity. And why would we? Let's be honest about this. If our historic pre-pandemic peak in ICU admissions was about 170 patients, well, why would we spend potentially billions of additional dollars to have hundreds of additional anesthesiologists, thousands of ICU nurses sitting around in staffing empty, let's say 1,000 empty ICU beds, waiting for a once in a century pandemic? I don't think that would be a rational allocation of resources, to sound like an economist. So we end up with a system where it's a good system. It has a lot of challenges and weaknesses. One of which is because of the rationing, we end up with these long surgical wait times that we're trying to overcome. But the long story short is that's certainly something we're going to have to discuss. And have an honest debate about post-pandemic. All right, Norrie Gaudette says, Jason Kenney, I would not want your job because no matter what you do, you can't make everyone happy. No, Norrie, you're bang on about that. It seems that every decision we make in COVID gets some people on either edge of the debate very angry. I do regret the degree of polarization in the debate in Alberta. We have a sizable portion of the population who have wanted more or less a hard lockdown throughout the pandemic, or at least very stringent restrictions, and who I don't think have fully appreciated, perhaps, the very damaging impact that these restrictions can have on the broader health of our society, on people's mental and emotional well-being. And then on the other end of the spectrum, we have a group that has been opposed to all or almost all public health measures and restrictions. People, and some of them are in total COVID denial, and they don't seem to care a great deal about the deaths or the limitations of our healthcare system. And it's unfortunate that so much of the debate in Alberta has been characterized by those extremes kind of screaming at each other. But I do believe that the vast majority of Albertans actually understand that the government has been trying to navigate a safe and sensible middle ground approach, which has been to prevent large-scale avoidable deaths, to protect our healthcare systems so that it's not overwhelmed, while at the same time seeking to minimize the negative effect of public health restrictions on our broader social health. That has always been our goal. I won't say that we've done that perfectly, but I think we've done quite well. And in fact, I would point to that we have a lower per capita COVID fatality rate than the rest of Canada, than other large Canadian provinces, than all 50 United States, and that almost all of the European countries. So in that Western world context, I think we've done quite well with lighter restrictions than almost all of those jurisdictions through much of the pandemic. All right, Tammy Stevens says, do you think masking will still be a thing in public in September? We are on PPP burnout for those of us who work healthcare. The answer, Tammy, is in September, no, I don't think so. I think that there will be obviously some settings, including hospitals, and perhaps long-term care, where even at high levels of vaccination, that additional level of protection may be called for. But as a general rule, no, I don't think we could possibly justify vaccines when people have received the second dose. The Centers for Disease Control in the United States has recently said as much, that there is the marginal advantage of wearing masks after you've received a second dose of a vaccine does not justify it. And so we have to get to those second doses. People have said to me, well, what if I have a second dose already? We would say, look, just please follow the current guidelines. We're going to be going for a much broader opening sooner than you might think. And I would just say that we don't want to get into a situation of vaccine passports, where if somebody's walking in the mall and security approaches them to say, excuse me, you're not wearing a mask, they say I'm double dosed, then the mall guard says, well, where's your proof of that? We don't want to get into all of that rigmarole about vaccine passports. So I would just say, let's stick with the safe rule that exists now until we can open up more broadly and people can get into that second dose territory. All right, just 1 second, please, folks. Tanis Veronica says, what lessons have you learned as a result of the pandemic? How will it change the way you govern? Great question, Tanis. So I think one lesson we've learned is that there's so many lessons. I would say that I think communicating the need for certain policies. I think we assumed from the beginning that everybody, or pretty much all people, understood the need to take extraordinary measures to limit the spread. I think I, as the Premier, and a lot of us in leadership positions, just assumed that was a given. And I perhaps at various points we didn't do enough to bring all of the public along with us. There has been this portion of the public, it seems to be about 15%, who don't appear to understand the very real threat that COVID has posed to our healthcare system, and the fact that it could have cost thousands and thousands more lives in Alberta, and perhaps didn't fully understand the rationale behind some of the public health measures and restrictions. So I think doing a much better job communicating about the rationale that lies behind policies to bring people along with you is one key learning that I would take from it. All right, so I've only got Tanis's question up there. Just waiting. Okay, there we go. Michelle Clark Pace says, good evening, Mr. Kenney. If we are more protected with the first shot, why can't we travel out of the country? Well, Michelle, thank you. First of all, the travel restrictions are the federal government's purview, not the provincial government. But secondly, you can, but it really depends on the travel restrictions of the country that you are going to. But our general advice is not to travel unless it's necessary or essential right now. Because when you come back, you're going to have to go through all the federal quarantine rules and get tested a couple of times, and it's a great inconvenience. We have to continue to be concerned about the variants that are circulating around the world. We don't want to bring more and more of those here. Right now, I think we have 9 proven cases of the Indian variant in Alberta. I would hate to see more of those coming here because of travel. But Michelle, I do think that we will be able to, the federal government be able to get to a position of relaxing the travel protocols this summer. I certainly hope so, and I'll be advocating for that as we get to reaching that critical mass of vaccine protection. All right, Chris Kilo Vowels says, please allow some of our high school graduations to happen. These kids are depleted enough already and need something to look forward to. Very good point. And I think we can do that in June with outdoor events, Chris. So stay tuned for more information on that. But They might have to delay a little bit by a couple of weeks the normal schedule for graduations. I mean, sometimes those grads start in May. Obviously, that's not a good idea right now, and really they shouldn't be indoors. But if schools can plan for outdoors events, especially later, more towards the end of June, I think that's something we can definitely accommodate. Leslie Jones says, Premier, will the legislature be in session next week? I missed the daily NDP Gong show. Oh, Leslie, if you are watching Question Period every day, then you've got to find a different hobby is all I can suggest. Yes, the legislature will be back in on Tuesday next week, a week from today. Kevin Stacey says, what percentage of outbreaks have occurred in gyms? I don't know the percentage, Kevin, but it would be, there have been many outbreaks in gyms. I would say dozens, in not just gyms, but also fitness activities, including like, aerobics class, things of that nature. So not necessarily just gyms per se. Gyms and fitness facilities would be dozens of outbreaks that we've recorded. And really, we have to understand that what matters here is the nature of the activity. There's two kinds of activity that are likely to spread COVID. One is indoor socializing, where if you're close to somebody, typically within 2 meters of someone for 15 minutes or more, and they are positive, there's a very good chance that they will transmit through those droplet projectiles. And similarly, when people get their heart rate up and they are projecting droplets more forcefully, as people naturally do in a gym setting. And by the way, folks, we're not, Alberta's not sort of ad-libbing this. Every jurisdiction on earth that has brought in public health restrictions has had to focus on those two vectors of transmission, which would be things that have a lot of socializing, like restaurants, bars, nightclubs, etc., and gyms and fitness activities. So it's not like Alberta has just been an outlier in this. We've been following the global science on this, on what are the most likely vectors of transmission. Leah Neely says, do you know what the plan is for post-secondary students in the fall? Yes, we announced this in Minister Dimitri Nicolaides announced this with the colleges and universities last month, that we fully expect full in-classroom instruction beginning in academic year 2021-22, so this upcoming September. I cannot foresee any problems with that, and hopefully all extracurricular activities and collegiate sports will be, and when I say hopefully, I cannot foresee any public health restrictions on those. Certainly not at this point. I mean, when I say it not at this point, that's barring some crazy new variant that completely pierces the protective effect of the vaccines, and so far, thank God, we have not seen that. Rocco Bartolotti says, will you help restaurants? They need more support. The grant money you authorize is not enough. What will you do to support the industry that has been devastated? Thank you, Rocco. So as you, I think you know, there's $30,000 available from Alberta in an unconditional grant through the the Small to Medium-Sized Enterprise Relaunch Grant, and we're also participating with the federal government in the Commercial Rent Assistance Program, which I believe is a 90% offset on commercial rent costs, and of course the federal government has continued with its wage subsidy program. And we have provided, we've covered 50% of the WCB costs as a government of Alberta for all small and medium-sized businesses over the past 16 months. So altogether, I think it's a pretty robust package, but we're constantly consulting with the industry groups, including Restaurants Canada, to see if more needs to be done. But I'm truly sorry for the restaurateurs who have been devastated, fantastic entrepreneurs, such a critical part of the economy that give people their first jobs. I just grieve for the restaurateurs who've gone through so much adversity this past year. All right, we'll go to Pam Walker. He is reading scripted questions. I don't know, Pam, did you script that? Folks, these questions are being asked on the Facebook comment section below. I've responded to 21 questions, and 2 of them were from people who are thinking this is all some kind of a setup. All right, Romington Alfred says, hello, sir. When can we expect the restrictions to ease? Well, as I mentioned, Romington, starting a week from now, and then through June. But it really depends on how Albertans respond. We've got to keep pushing the curve down to end this third spike, and more Albertans have to get vaccinated. We crossed the 50% threshold of the eligible population for vaccination today, and we are aiming for 80% of the population. So the way you can help to bring that date forward when we lift all these restrictions is to do your part to get vaccinated, encourage your friends and loved ones to do the same. David Dorward, hello David. Any comment on Trudeau's statement that Quebec can change the Constitution? Yeah, David, I didn't see the statement, but it is true that that provinces can unilaterally amend the Constitution for with respect to provisions that affect only them. So I'll give you an example. Quebec did that. When I say unilaterally, they have to do it with the consent of the federal parliament. But on matters that only affect a particular province, the amending formula is that province and the federal parliament, not 7 plus 50 of the provinces. So I'll give you an example. Back in 1997-98, the province of Quebec brought forward an amendment to Section 92 with respect to the constitutional guarantee for confessional education. They wanted to remove that. They passed that through the Quebec National Assembly. It was ratified by the Parliament of Canada. Similarly, the province of Newfoundland brought forward a similar amendment to what was called Term 7 of the Article of Confederation for Newfoundland and Labrador. Again, that was a unilateral matter about deconfessionalization of the Newfoundland school system. Again, it was ratified. So it is possible for Quebec to do that on certain things, not on the division of powers. I heard somebody earlier today, an MP suggest that this could be done on Section 36, which is equalization. That's a misunderstanding of the amendment formula. Because Section 36 implicates all provinces, it would trigger the 7 plus 50 formula. That is 7 provinces representing 50% of the population, plus both chambers of the federal parliament. All right, Leanne Winnetoy-Smith says, Montreal is allowing fans to the stands for NHL games starting May 29th. We better allow fans too. Well, Leanne, I hadn't heard that. Good for Montreal. I'll just say that Quebec has much lower levels of COVID than we do here in Alberta right now. They did much worse through much of the pandemic, but for months now, they've been in a super hard lockdown, stay-at-home orders, curfews. As it is, right now, you cannot leave your home after 8 p.m. in Montreal without being fined with like a $1,500 fine. And it's because of those incredibly tough measures that we would never introduce in Alberta, that they've got those numbers down. And I'll just share this with you. So Quebec has, they currently have 484 people in COVID with hospital with a population twice our size. We have 691. So they are at 0.57 people per 10,000 in hospital. We're at 1.57. So our per capita hospitalization rate is 3 times higher than Quebec's. Our per capita ICU rate is 4 times higher than Quebec's. Our cases in the last 7 days is 4 times higher than Quebec's. They've had 4,900 cases, and we've had 8,900 in the last 7 days. So if they can do that, bully to them, but they've paid a very high price in getting those numbers down with by far the most draconian restrictions in Canada. Stephanie Hallett says, do you expect provincial borders to open by the end of June, beginning of July, BC in particular? Well, they've never been completely closed, so there's no border checks, and I'm not aware of people who are being penalized for traveling between provinces. But the government of British Columbia has strongly discouraged out-of-province travel, and they're not allowing hotels, for example, to book out-of-province, like Albertans going to their hotels for the time being. I am very hopeful that will change in July. I will certainly push hard for that to change in July, based on where we are at here in Alberta with the pace of vaccination and the COVID numbers coming back down. Right now, I would not see us having a travel advisory against interprovincial travel as we move into July and then August. So I think there's reasons for optimism about that. Nancy Shanuda, hello Nancy, nice to hear from you. And hi Premier, how do you foresee Alberta's economy recovering post-COVID, especially in light of global massive inflation pressures? That's a very good question, Nancy. So 4 of the major banks in Canada, plus multiple think tanks like the Conference Board, have projected that Alberta will lead Canada in economic growth in 2021. They estimate between 6 and 8% growth in our GDP. That may be down a bit because of the severity of the third spike in our province, but we really believe that we are set up for very strong growth in the second half of this year, after Canada Day, in the third and fourth quarters. And you know, despite the damage of the COVID recession, we have a lot of our sectors that are doing incredibly well right now. We had, I think, the second best year on record for farm revenues. So agriculture is doing extremely well in Alberta, and more investment is coming to value added in that sector. Forestry is having the best year ever. More and more jobs being created there. We've had the best year ever already in venture capital, which fuels digital tech startups. We've had great good news in Calgary and elsewhere in a lot of new tech startups announcing that they're creating jobs here. Film and television is off to its best year in Alberta history. We were lined up for some major potential investments in areas like hydrogen, carbon capture utilization and storage, renewable energy, irrigation, petrochemicals, and much more. So much of this is being supported by Alberta's recovery plan, including our huge, unprecedented infrastructure investments. We'll be announcing a massive job training program tomorrow to help get unemployed Albertans the skills they need to benefit from a growing economy. And so inflation will be an issue, but we can't really control inflation policy. It's federal monetary policy that has the ability to do that. Bonnie Park says, please tell us how many people have natural immunity after COVID-19 and how will you count them in immunization totals? Great question, Bonnie. So we keep a very close tab on that. We don't know the exact number, but based on our sero surveys, those are where we do an analysis of blood samples, anonymized, to identify the prevalence of SARS-CoV-2 in the population. That's the virus that causes COVID-19. Based on those sero surveys, we estimate that about the number of people who have been infected with COVID is about 4 to 5 times the number of people that we've tested, that have tested positive. So we've had about 200,000 people who have had COVID, and we estimate that about 4 times that, about 800,000 have had the disease and therefore likely have some degree of protection. And we work that very much into our analysis of population protection. So we'll be providing more information on this about a week from now in terms of our path forward for reopening, but it will be predicated not only on the percentage of people with a first dose of vaccine, but also those who have been COVID positive. Now, I should say that there is an overlap. Obviously, many of the people getting vaccinated now may already have the antibodies, and many of the people who have the antibodies never knew they had COVID. They never exhibited any symptoms, and nor did they get tested. All right, I'm going to take one more question because this is now question 26, and we've been at this for over an hour. So Leslie Pohl says, why is our Tim Hortons shut down because of COVID, but the Wendy's is still open? Same building. How much money are you making off of these shutdowns? Leslie, I'm not making any money off these shutdowns. That would be a decision of the Tim Hortons operator. Because they're able, like the Wendy's and any other restaurant, to operate for takeout or delivery. They just can't do sit-in or patio service right now. But there are hundreds of Tim Hortons franchises open and operating across the province. All right. So with that, I'll wrap it up. So thank you very much, folks, for the questions, and I do appreciate them. And hang in there. I'm just so grateful to Albertans for responding to the call, in acting and doing the right thing to reduce that social interaction, which spreads the virus from one to many. As a result, we've seen our numbers coming down. That is great news. It means that our hospital numbers will come down. They're going to go up for a little bit here, but they will start to come down. And thank you, especially to everybody who has gotten vaccinated or made an appointment to do so. You are the folks who are going to get us out of this. Our path to freedom and to normalcy lies through the vaccines. So please, folks, follow the lead of the majority of Albertans and people around the world. We should regard ourselves as extremely fortunate. As I mentioned earlier, there are many countries like India that have massive deaths right now because they don't have adequate vaccine supplies. We are finally starting to get those supplies. We are the beneficiaries of this miracle of modern science. And let me just say this to the people who are vaccine skeptical. Thanks to vaccines, tens of millions of lives, perhaps the lives of your children, have been saved because of vaccines that have largely eliminated diseases like polio, mumps, measles, chickenpox, and so many others. We have been safely using vaccines to eradicate disease and save millions of lives for over a century. This is the time to step up. The speed with which we can relax public health measures and get back to normal, get all of our freedoms back, get our lives back, is dependent on how many folks decide of their own volition. Nobody's being compelled or coerced, but how many folks make the responsible decision, responsible not just for themselves, but for their families, their loved ones, and their neighbors, responsible for our whole society. So please get out there and get your appointment for a vaccine. We will get it to you as quickly as we can. And if we go into June with huge momentum on the vaccines, taking up every available dose that's there, I assure you we will be able to get back to normal earlier than you might expect for a great Alberta summer. Thank you. God bless. Look forward to talking to you next time.